24 minutes before 11 o'clock. Thank you for tuning in. If you or somebody you know has ever gone through chemotherapy, then you know there are some side effects to chemotherapy. While it's, of course, doing its job to get rid of cancer, it's also affecting you in some ways. And it turns out, may not be necessary, or we're going to find out about this. Scott Soefje is on the phone. He is the president of the Hematology Oncology Pharmacy Association and the director of the pharmacy at the University Medical Center, Breckenridge in Austin, Texas. And on the phone also is Mary Van Dyke. She is a chemotherapy-induced nausea and vomiting patient from Kansas City, Kansas. And it says here there is a national survey that reveals that patients are suffering needlessly from chemotherapy-induced nausea and vomiting. Let's find out what this is about. And I'm guessing we have some listeners who can relate to this, and they're probably listening keenly. Scott Soefje and Mary Van Dyke, good morning to both of you.
Good morning.
Good morning.
Are you in Dallas or Austin? Are you in Texas right now?
Yes, sir. I'm in Austin, Texas. It's raining today here.
It's raining. All right. Mary, how you doing?
I'm doing well, thank you.
So Scott, what was the national survey? And there must have been an inkling that there was something to this, otherwise there wouldn't have been a survey. Am I right?
Yeah. For the past 30 years, we've had drugs that are effective, we've been shown in studies to be effective at preventing nausea and vomiting. But we believed that they weren't being used to their fullest. So HOPA, in association with ASI, conducted a study of 400 patients. The Wakefield Research Group actually helped us do that study. And we were trying to find out how patients were experiencing CINV, what was happening to them, were they being treated appropriately, etc. One of the things we found that was really disturbing to us was that 83% of the patients thought that the nausea and vomiting was just a side effect that they just had to live with, that it was just part of chemo and there was nothing we could do about it.
Okay.
So we put together this campaign to say, yeah, it's time to talk about it. There's things we can do to help.
Okay, so maybe it's a communication thing. Maybe. Am I guessing right?
In many points it is. When Mary tells her story, you'll hear that the medications were there, but she was not really clear on how to take them, and once that was kind of cleared up, things got better.
So Mary, when you started the chemotherapy, I'm guessing you were told this could cause you to be nauseous. Were you told what to do in that event?
Well, I had a wonderful care team when I was diagnosed a year ago with ovarian cancer. But in the beginning, you're just trying to be courageous and listen as well as you can in these care plan meetings. My pharmacist was actually a member of my care plan meeting at the cancer center. But in the beginning, I didn't realize that the nausea and vomiting was something that could be prevented. I would become ill 4 days after the chemo, and it wasn't until I was advised by the pharmacist to take the medication even though I didn't feel nauseated. It was a prevention before I became ill.
Oh, really? Wow. And is it something, it was so, and did it work was it very effective?
It was very effective for me. You know, there were dark days, but I just tried to stay positive day by day and be honest in how I felt. I was able to keep a journal and write down questions, because sometimes over time you forget what the most important thing is you want to ask. And I think it helped my pharmacist to be able to say, oh, on that day, oh, here's what might happen. And she was able to guide me as a tutor through much of my treatment.
Wow. For the listeners, I know this is a short interview, so I'm guessing that the best thing we can do for the listeners, in addition to talking about this, is giving them a website. And what we're talking about is chemotherapy-induced nausea and vomiting. Those four words are important because CINV is what it's called for short. And there's a website that uses those four initials. Am I right about that, Scott? Did I get that right?
Yes, sir. It's timetotalkcinv.com.
Okay, so that's the website that'll be ultimately the best place to get information after we're done with the interview. TimeToTalkCINV.com. So, Mary, are you cured of your cancer, or is it? I don't mean to get too personal, but are you okay now?
You know, from November 1st of last year to August 25th, I am in remission. I feel very blessed that I had such a good care team, and
wow, that's great.
Very fortunate.
I like the fact that you are intimate with your pharmacist, because most times, you know, you go to the doctor and the doctor sees you, they know what's going on, but there is a special bond between a patient and their pharmacist.
Oh, I certainly agree. And the fact that I was assigned to the same pharmacist every week through treatment was just so fortunate for me, because I could open up to her with any kinds of questions that I would have.
Wow.
And you know, I think a lot of people don't realize that many of the cancer centers in the United States actually have a pharmacist. And so if a patient has questions about their medications, they can ask to see if there's a pharmacist on staff that can help them describe the medications.
Wow, and that specific pharmacist working at an oncology center, for example, would be maybe, I'm just guessing, more familiar with the kinds of things that would prevent nausea. Am I right?
Yeah, it's a specialized training that many of us go through over a course of time, and then of course with the experience that you see other patients and how other patients handled it, you have all kinds of tricks up your sleeve to help people get through some of these days.
Is radiation being phased out where chemotherapy is the only treatment now?
No, not necessarily. Radiation has its place. Radiation is considered a local therapy, whereas chemotherapy is considered a systemic treatment. So it all kind of depends on the tumor. Some tumors are radiosensitive, so they'll respond, others won't. And it also kind of depends on whether the tumor has left the primary site and metastasized.
And will people react to the radiation treatments like they're doing the chemotherapy with CINV?
There can be nausea and vomiting with radiation, particularly if the radiation is anywhere near the stomach or the gastrointestinal tract. And so that's something that patients need to be watchful for. And again, talk to their radiation oncologist, because they have access to the same drugs and they're just as effective.
Yeah, I don't know enough about what I'm going to ask you, but I know that our listeners normally would ask this question. We have some listeners who are into the herbal and the holistic approach to things. So since they can't call in because you're on the line that they normally use, because there's something up with the other line, so I apologize to our listeners for not being able to call in. So I'm going to ask a question that I'm expecting is out there, and I'm guessing you know where I'm going. The medication that does work, is there an alternative in the holistic or the herbal world?
For the nausea and vomiting, I have found very few things in the herbal world that works. I'll be honest with you, 30 years ago when I started this journey, I was one of those people that believed that herbal meds were hocus pocus and you shouldn't do them. But over the years, I've seen that some people have had benefits from them. And so the only thing we ask about the herbal meds is that you tell us that you're taking them, because some of these meds do have drug interactions. And so we want to know what you're on, so that if there's any drug interaction, we can anticipate it. And then what I've always told patients, I'll go look up the herbal and tell you what the literature says, and then you make a choice on whether you want to do it or not.
All right, good answer. I know you've got other interviews to do. Scott Soefje and Mary Van Dyke, thank you both. I'm glad you're doing well, Mary. And thank you for being.
Thank you.
Thank you for your bravery. I think you're an inspiration just by being on the radio today. The website is
thank you.
TimeToTalkCINV.com. If you can't write it down, you're busy driving, we understand. It'll be on Facebook at by 2:00 today, as will this interview, and also on the WLCA YouTube channel. Again, Scott and Mary, thank you both so much.
Thank you very much.
You're welcome.
All right, we'll take a break. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, partly sunny skies, breezy and warm with a shower in spots. The high 82 to 86. Partly cloudy tonight. There may be a shower along the coast. Low 63 and a few inland spots, but closer to 73 at the coast. Tomorrow, times of sun and clouds and breezy with a stray shower along the coast. High 82 to 86. For Saturday, sunshine, some clouds and a passing shower with a gusty wind. High 82 to 86. From the Florida Weather Center, I'm Joe Lundberg.
Are you in need of custom screen printing, embroidery, or promotional items? Then look no further and come visit the brand new Legacy Team Sales. LTS is conveniently located off 17th Street next to Armstrong Homes in beautiful Ocala. We offer the best prices and highest quality products for your company, team, school, or nonprofit. Whether looking for screen printed shirts, embroidered polos, or travel team uniforms, you'll be sure to find it at Legacy Team Sales. Come visit our new 27,000 square foot facility. Our friendly and knowledgeable sales staff will assist you in every part of your custom purchase. LTS carries the hottest brands in the industry like Under Armour, Russell, Mizuno, Asics, Badger Sports, Gildan, Pacific, Ogio, and many more. At LTS, screen printing embroidery is done in-house and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
If you're anything like I was, the thought of getting older was the last thing on your mind. But here we are. For me, it started slowly. The lack of energy, never being in the mood. And when I was, I could never perform at my best. I tried the pills and other treatments with minimal results, and all but given up on my sex life. Then I found the doctors at New Male Medical Center. Wow, they made a new male out of me. Feel like I'm 25 again. I have renewed vigor, so much more energy, and no longer worry about my performance. New Male treated me like my situation was one of a kind, with a custom treatment plan that really works. I feel great. They can create one for you too. It does not matter if you suffer from low testosterone, erectile dysfunction, or just want to last longer. New Male will help you.
Call New Male Medical Center today at 352-404-4779. 352-404-4779. That's 352-404-4779. It will change your life. 352-404-4779. Attention homeowners, if your sinkhole case was denied during the past 5 years or repaired, but there was little or no money left to finish fixing your property, you may qualify to receive up to $15,000 through a sinkhole repair management program in your area. This government program is offered to owners who feel that their sinkhole claim was unfairly denied or repaired, but there was little or no money left to finish fixing their property right. For a free inspection and consultation, call Sinkhole Savvy today at 813-403-7809. 813-403-7809. That's 813-403-7809. Sinkhole Savvy.
Are you looking for a durable farm fence to keep your horses enclosed?